Hello, my name is Katie Henches, and I'm the Director of Programs at the Child Neurology Foundation. Thank you for listening into our talk titled Telehealth, A Lasting Impact. As CNF enters its 20th year, we're honored to have partnerships with groups like Neurocrine, who is sponsoring this video. Partnerships like this give us the ability to tackle big issues in our community as we look ahead to our next 20 years. We have identified telehealth as one of the biggest topics facing our community, and Neurocrine has placed us in contact with two of the nation's leading experts in how telehealth affects and will continue to affect the child neurology community. Today, I'm joined by Dr. David Charles, a professor and vice chairman of neurology and a medical director of the Vanderbilt Telehealth Clinic. Later on in the video, we will also hear from Kendra Martello, the Executive Director of Public Policy at Neurocrine Biosciences. Both Dr. Charles and Ms. Martello will share their expertise with us so that we can learn more about how telehealth is affecting the healthcare landscape for the child neurology community. So with that, thank you so much for joining today. Dr. Charles, I do have a few questions for you, so I'll jump right in. What do you find with the pivot towards telehealth during COVID-19? How did your day-to-day work change?
Well, so one of my roles at Vanderbilt University in Nashville, Tennessee is serving as our medical director for telehealth. And so that's for the entire institution, both the adult and children enterprises. And so the way my work changed was quite dramatically, in fact. So I began in this role in 2012, so almost 10 years now. I've been working on telehealth, but in March of 2020, everything changed, right? Before the pandemic occurred, we had a real challenge in getting adoption of telehealth. Sometimes physicians were reluctant to use it. Sometimes patients were reluctant to give it a try, but most importantly, payers, health insurance companies, did not want telehealth to really take hold. In fact, many of them actively lobbied against bills that would make telehealth available to patients. They lobbied actively at the state and federal level to do almost everything they could to prevent, the adoption of telehealth. I think they kind of thought that maybe, if patients could do a healthcare visit from their home, that they might just sit on the couch all day and just do one telehealth visit after another, and there would be this rampant overutilization of telehealth. But what we learned in the pandemic is that's not true, right? As when the pandemic happened and the federal government took steps to open up telehealth, and they allowed patients to have telehealth visits with their healthcare providers directly from their home or from a private place at their work location, what we found is that people could have access to healthcare. They weren't overutilizing it, and it provided incredible efficiencies and savings for the patient and often their families. So the way my work personally changed was in March of 2020, we trained at Vanderbilt about 3,000 faculty and staff in the use of telehealth. And we rapidly increased the number of telehealth visits being done per day because of the steps the federal government took to about 2,500 visits per day. On any single day, we're doing more telehealth visits than we had done in the entire prior year. So the pandemic has, in fact, been transformative for telehealth. And now that millions upon millions of Americans and hundreds of thousands of healthcare providers have used telehealth, it's here to stay.
Awesome. Thank you for sharing your insight and your experiences. So how is telehealth working out right now for your patients and your families?
Yeah, it's working out great. So patients now have the option for in-person visits and telehealth visits. And of course, it depends on what's the nature of the healthcare visit. Can it even be done via telehealth, or should it be an in-person visit? But now we have the option of both, right? Both are available. And so I can share a story. I had a patient who is in his 70s, lives about 4 hours from our campus, each way, a 4-hour drive. He was being seen for an annual visit, for a checkup, for a medication that was working. And for his visit, as his physician, I didn't need to do any hands-on part of the physical exam. I needed to hear from him, was the medication helping? Was he having any side effects? And did he need a refill? right? And so we were able to have that visit in about 20 minutes via telehealth. And I asked him at the end of the visit, I said, how did you like, how do you like having these telehealth visits? And he said, well, the first one was kind of hard because I couldn't figure out how to get the camera working on my tablet and so forth. He said, but now, Dr. Charles said, I love it. He said, I don't want to come back to clinic unless I absolutely have to. He said, telehealth has saved me an entire day of my life. He said, I would have spent 4 hours driving over there, parking, getting into clinic for this 20-minute visit, 4 hours driving back home, the traffic, the hassle, the air pollution, the consumption of gasoline, the cost to him. And so you can see by that example that, wow, right? For some telehealth visits, not all, but for some healthcare visits, telehealth is the way to go.
So you've discussed, obviously, some of the benefits. I'm curious if there's any other benefits you've seen or if there are any significant challenges you've seen with your patients and families.
Definitely challenges. The challenges, that he mentioned. Sometimes people have trouble connecting. Maybe they're not sort of tech savvy, if you will, and maybe their camera's on, but they don't know how to turn the microphone on. So there'll be some technical issues like that. But I will say that people pick it up pretty quickly for the most part. Another challenge is, in my state, 1 in 4 Tennesseans lives in a health profession shortage area. What that means is that there are few healthcare providers near where they live. Kind of going hand in hand with that is also, for these rural areas, sometimes difficulty accessing broadband internet connection, right? And a broadband connection, a high-speed internet connection, is the backbone upon which telehealth happens, right? So if you don't have that kind of access, it's hard to make telehealth work. But for the other benefits, let me share another benefit with you. Actually, a colleague of mine shared this story. So he had a patient with a medical condition that in general is easily treatable. With a course of medication, the patient should respond and the condition should be well managed. But yet this patient wasn't responding and their condition wasn't well managed. And he's in this telehealth visit and he's asking the patient about how they take the medicine and such. And so finally he said, let me see your medicine bottle. So the patient took their tablet and they walked over to the counter and he said they turned the camera around and he said there were dozens of pill bottles on the counter, more than he could count. And they were pills that were out of date. The person no longer took them. The patient was confused as to which medicine he had prescribed and wasn't taking it, right? And so right there, right, that would have never happened in the clinic. You would have never gotten that insight into the patient's home. So in that moment, he realized the problem, right? We had to get rid of all of those medicines. And he talked to the patient's daughter, I believe, who was also there. So they packed up all these old medicines, disposed of them properly, then just had the medicines that he was supposed to take, re-explain the directions, right? A few weeks later, the expected response, patient's doing well. So that insight, being inside someone's home, that's pretty remarkable.
We're hearing similar feedback from our families and providers. The kiddos in the child neurology similarly are very excited to share some of their world with their physician, and it can impact the decisions the physician makes. So in an ideal world, what does the future of telehealth look like to you, and how close are we to that ideal right now?
Well, I think we're moving in the right direction. Here's what I feel the perfect state should be in the future, and policymakers have to get this right. Okay, so here I think is the recipe, if you will. So telehealth is here to stay. And so if the patient and the clinician feel that a telehealth visit is appropriate for whatever type of healthcare is going to take place, then it can be a telehealth visit. And the insurance company can no longer prevent it. And they're going to have to pay for it on par with an in-person visit. Okay, now, if the patient wants a telehealth visit, but the clinician goes, gosh, no, that I'm going to need to do a physical exam that's going to involve palpating or listening or something that we just can't do over telehealth. So even if the patient wanted telehealth, but the clinician didn't feel like it was medically appropriate, then it has to be an in-person visit. And here's what we also can't have. We can't have insurance companies telling patients that you can't have an in-person visit. that you have to do the visit via telehealth because the clinician may know that it's not medically appropriate for that patient for that visit. Okay. What about the situation where the clinician thinks this visit is okay for telehealth, but the patient says, I want an in-person visit? In all cases, if the patient wants an in-person visit, then it's an in-person visit, right? And again, the insurance companies cannot step in and create policies that tell patients they can't have in-person care if they want it, or if their clinician feels that it's essential for their health care for that visit.
So how do you think we get to that ideal? Are there any steps that we can take to get there?
Well, yes. So there are lots of bills have been introduced at the federal level that are trying to address telehealth. So during the public health emergency, when the federal government knocked down all the barriers that were in place, they said, okay, we're going to pay for telehealth. Patient can do telehealth from their home or a private place at their work location. They don't have to come to a clinic, in other words, that sort of thing. They knocked down all those barriers. To keep them in place after the public health emergency, there needs to be federal legislation that passes and is signed into law. So what can we do as clinicians and as patients? We can become involved. We can be advocates for good policy to ensure that patients have access to both telehealth and in-person care.
Awesome. So can you talk a little bit about what this means to you, how the change has impacted you as a clinician, and how does this change the way that you work?
Yeah, so for me individually, I use telehealth, and obviously I do in-person visits as well. So it's enhanced my practice for sure. For me individually, also in my role at Vanderbilt, one of the jobs we have before us is refining telehealth so the patient's experience is better. Here's what my vision is for how telehealth visits should go. If you are going to see me as a patient at telehealth, as soon as you log in for your appointment, you should be greeted by someone who's at the front desk. They should greet you by name and they should thank you for choosing Vanderbilt, in this case, for your care. They could also go through some things with you, could check your medicines, make sure that your insurance card is up to date, that sort of thing. And they could update you on, oh, your clinician is running about 5 minutes behind, so we'll have you wait, but don't be concerned, they'll be with you very soon. And then the visit happens. And then at the conclusion of the visit, think about what happens in person. You go to check out, right? And so when the clinician finishes with the patient, then the checkout person has to come back on with them. And so there may be some studies. What if a person needs an x-ray or some laboratory studies? Where do they go to get those labs? What if they need a follow-up appointment? Say in 6 weeks, they need to be seen again. Let's make that appointment right now. And then they should thank you for choosing Vanderbilt for your healthcare or whatever is appropriate, right? And so we've got to refine this process. In the waiting room, right, we should be giving you information on your screen that's helpful to your healthcare, right? Let's say that you do have an unexpected 10-minute wait. Why can't we use that 10 minutes? Let's say that you're a person with asthma, to update you on the latest things we know about asthma, things that you could do to help take care of yourself. What about healthy diet, exercise, and things like that? So we need to develop that content, and it needs to be tailored to the individual person and what health problems they may be experiencing, to give them information that actually benefits them while they're in that waiting situation. So all of those things are possible. The technology to do that is already here. It's a matter of refining it and getting our work processes there.
That sounds amazing. As someone who uses telehealth as well, that process sounds awesome. So from all the different ideas you've had and what you've seen other people doing, is there anyone out there who's leading the charge on doing this and refining the process? And how do listeners get involved with those people who are making a difference here?
Well, I mean, I'm really biased in this one, right? We're leading the way at Vanderbilt, right? So I'll leave that one right there. But how can people become involved and be advocates for telehealth? Well, here's something that I've found that's incredibly helpful. There's an organization called Patient and Provider Advocates for Telehealth. Patient and Provider Advocates for Telehealth. And it's easy to find. The website is telehealthadvocates.org. Telehealthadvocates.org. Go on that website. And there are resources there and ways that you as an individual can become active and have a voice in the policy debates that are ongoing right now that are going to set the course for telehealth going forward.
So how have these people who've done it successfully or have ideas out there in the space handled this transition? And is there anything that we can or should learn from Vanderbilt or other organizations that we can implement today?
I think the take-home message for where we are right now is a couple of things. One, we're never going back. Right? We're never going to let insurance companies tell us that we can't have telehealth visits anymore. Right? So that's first and foremost. Second is we have to become advocates, and because this is being debated right now at the federal level, and what passes will have an impact on all of us and how we receive our health care. So we've got to get it right. And so that's why they need to hear from patients, and they need to hear from clinicians and providers about what policies need to be in place for telehealth. But at the highest level, it goes back to what I was saying before. The decision for a telehealth visit belongs only to the patient and the clinician. The insurance company has to stay out of it, right? An in-person visit's what's needed. The insurance company cannot prevent the patient from having that in-person visit. If a telehealth visit is agreed upon by the patient and the clinician, then the insurance company can't prevent or not pay for a visit conducted via telehealth. Those foundational principles, I believe, will guide us to the right policies for telehealth.
Awesome. So I just have one last question for you. Have you come across any resources that you think families should check out or providers should check out?
Yes. So again, back to that same website I mentioned, telehealthadvocates.org. Right across the top bar is a resources button. That's the one I recommend. So telehealthadvocates.org is the web address for patient and provider advocates for telehealth.
Perfect. Thank you so much, Dr. Charles. All right, I'm going to transition over to asking questions to Kendra Martello.
Very good. Thank you for including me.
Kendra, I have a question for you. With the pivot towards telehealth towards COVID-19, what impacts did you see among patient populations with whom you work?
Thanks so much, Katie. When the public health emergency first began, telehealth was an important lifeline for patients and providers. As time has progressed, however, we now realize that patients must be able to be seen in person in order for quality care to be provided. For example, if you consider a person's living with serious mental illness, exposure to antipsychotic drugs can lead to other conditions such as involuntary movement disorders like tardive dyskinesia. This is a serious, persistent, irreversible condition that's characterized by involuntary movements across the body, in the face, the torso, the hands, and the feet, as an example. And when a telehealth intervention is a phone call, it's impossible to determine if a person is experiencing those involuntary movements. In fact, in a survey we conducted earlier this year, the vast majority of neurologists and psychiatrists responding to that survey found or confirmed that they did not screen for these involuntary movement disorders when the visit was conducted via telehealth. And when it's a phone call, that intervention, 3 out of 4 patients just were simply not evaluated. And from my perspective, patients deserve more. While an audio-video telehealth visit is better, the provider is still quite limited in what they can observe in patients. In particular, if you think about difficulty with gait or walking, which are sort of predominant in involuntary movement disorders, this is the most commonly reported challenge with audio-video telehealth. The risks of falls in elderly is a significant concern. So if those things are being missed in a telehealth visit is something that, from my perspective, providers, patients, and policymakers should pay attention to. On average, our survey also revealed that visits with doctors were 10 minutes shorter when they were conducted via telehealth. So if you take these two things together, doctors and patients are spending less time together, and they're not screening for important issues when telehealth is utilized. This could potentially lead to worse health outcomes in the long term.
Thank you for that. So what are some of the benefits that you're seeing for families and providers with telehealth? And you've already discussed this a little bit, but retouching on some of the challenges as well.
Sure, be happy to. Benefits that have been well documented include a reduction in the number of missed appointments, increased access to specialists, and frankly, reduced wait times in trying to get in to see a clinician or a specialist as examples. In a survey that we conducted, or that we sponsored, that conducted for us by the Harris poll last summer, while respondents agreed that they really appreciate and like the convenience of telehealth, most felt that it frankly didn't meet all of their healthcare needs. 80% said they would always prefer an in-person visit with their doctor, and more than half expressed concern that the doctor may miss something during a telehealth visit. In another study released last summer, it reported that while behavioral healthcare needs have increased as a result of the pandemic, the claims data that was analyzed, frankly, didn't show a corresponding increase in utilization. And the report concluded that nearly half of all behavioral healthcare services weren't suitable for provision over telehealth. This also tracks with data from the Center for Medicare and Medicaid Services, which was released last year, demonstrating that after an initial spike in telehealth utilization in April 2020, telehealth visits for mental health services continued to decline. And in another report released last summer, less than 15% of Americans overall have reported using telehealth during the pandemic. So one factor that might be contributing to this declining utilization is the so-called digital divide. Patients may not have sufficient access to broadband or internet that would allow them to have a meaningful telehealth visit with their provider. Or they frankly may not have a space, a private, a secure space to have that consultation. And while telephone calls with providers are permissible, it's not possible, as I mentioned before, to screen for or diagnose certain conditions such as involuntary movement disorders when the telehealth visit with a provider is simply a phone call. So what are the long-term impacts of these shifts in care? From my perspective, many of them are still unknown. Much of the literature and reports to date address the kind of adequacy and acceptability of telehealth, but they're silent on key measures that I think we need to use to evaluate sound policy going forward, such as quality of care, cost, and health outcomes. So I think more data and information on the long-term impact of the rapid shift to telehealth can be beneficial. And then the last area where policymakers have raised concerns is whether increasing use of telehealth also increases overall healthcare utilization. So some insurers, it's been reported, are adopting a virtual first policy. And while that could initially be seen as positive, particularly for routine types of interventions, particularly where the patient and provider agree that this is appropriate, to the extent they also agree that an in-person visit is necessary for quality, effective care, you've now encompassed 2 visits when one may have sufficed in the past. And again, circling back to patients or persons who don't have sufficient internet access, these virtual first policies can be problematic.
So going off of that, in an ideal world, what does the future of telehealth look like to you, and how close are we to that ideal right now?
So in an ideal world, telehealth is one modality for delivering care. It's an important modality, but it cannot, and it should not, in my view, replace all in-person visits. Rather, telehealth should be a complement to, not a substitute for, in-person care. As I've mentioned earlier, with the patients that we've seen that we interact with, those living with involuntary movement disorders such as tardive dyskinesia, the inability to adequately screen for as well as diagnose certain conditions remotely creates significant challenges for those patients and for providers alike. So as we assess the future of telehealth, again, the questions for me is how do we strike the right balance between virtual and in-person care? How do we ensure the highest quality of care for all beneficiaries? And again, data and information, in my mind, is the way to help answer some of those difficult questions.
So at the end there, you've addressed this a little bit about gathering more data, but to expand on that a little bit, how do you think we get there and what is it going to take?
Yeah, I think it's going to again, take the collection and the analysis of relevant data, again, on cost, access, quality, and outcomes. And while much has been written about the ability of telehealth to expand access to healthcare, particularly in rural and underserved areas, for this reason, it's thought that increased use of telehealth then improves care. And while there's no dispute, none at all, that increasing the use of telehealth, and in particular, telehealth in a phone call, can potentially increase access to healthcare, the question remains in my mind, at what cost? Again, to outcomes and quality of care. In a report that was published in Time this past summer, authors argued that while telehealth inarguably improved healthcare access to mental health care services in particular, that same report also noted that existing structural barriers that were in place before that keep people from seeking care, those actually persist, even in the face of expanded use of telehealth. And a report from the Urban Institute and the Robert Wood Johnson Foundation confirmed that, kind of further clarified that, persons who are older, who don't speak English, maybe in poorer health, may not be adequately served by telehealth alone. So again, in my mind, we keep coming back to this notion of a balanced approach and the need for telehealth to serve as a complement rather than a substitute for in-person care.
So as we look to future use of this modality, how should regulators weigh the needs of both patients and providers in their decisions in this area?
Yeah, so continuing to take into account the perspectives of both patients and providers will be important for long-term decision-making, particularly as it relates to the use of audio-only telehealth, which is, in my mind, has some significant limitations when you think about that as compared to audio video or in-person telehealth, where you can see the whole person and see everything that's going on with them. So again, from my perspective, there's not a one-size-fits-all solution, and we must continue to monitor the impact, the utilization, and how that has translated into outcomes, quality of care, and cost.
So from what you've seen, who out there is leading the charge on telehealth use, and how do listeners get involved with those who are doing this difficult work?
Yeah, so one group that comes to mind is a group called the Patient and Provider Advocates for Telehealth. They submitted some recent comments to the Center for Medicare and Medicaid Services, and collectively more than 40 groups under that organization representing persons with chronic conditions, Parkinson's disease, mental health conditions, and others, they wrote in calling for a balanced approach to telehealth. And again, that no matter what, when it comes to in-person care and telehealth, it's really not an either-or proposition.
So how have these organizations successfully handled the transition? Is there anything we can or should learn or implement from them right now?
Continued education, both for providers and patients, about how to conduct and participate in an effective telehealth visit could be useful. And patients should continue to feel empowered to request to be able to see their provider in person when they feel it's necessary. Our internal surveys have also demonstrated that the presence of a caregiver, where appropriate, can also facilitate a more effective intervention with a healthcare provider and a patient. So we would encourage that we can't overlook the important role that supportive caregivers play in helping to facilitate a positive telehealth interaction.
So going along with that, the education and everything that organizations are doing in this area, have you come across any resources that you think are helpful for families or providers? I know you've made references to a few studies earlier, so we'd love to share those with our community.
Yeah, I'd be happy to share those with you, Katie. And then also CMS has some educational materials, both for providers and how they can set up a telehealth services in their practice, and then also for patients and caregivers. Certainly the Child Neurology Foundations, the tips and tricks and other tools that you have available will also be helpful for families and providers.
Awesome. Thank you so much for sitting with me today and answering all of my questions. So that concludes our program for now. On behalf of CNF, I'd like to thank both Dr. Charles and Kendra for sharing their time and expertise. For more resources on telehealth, please visit childneurologyfoundation.org/telehealth. And for more information on what we're doing over our next 20 years at CNF and to get involved with helping us shape our future for the next 2 decades, please visit childneurologyfoundation.org/next20. Thank you so much.